And then moving forward, they ask about drug costs, right? Drug costs, very important, huge thing. The pharmaceutical companies are costing millions of dollars. This question is specifically about insulin. Let's see how he answers.
Student at the University of Maryland. She's been living with type 1 diabetes for 16 years. Annalie.
Hi. So the rising cost of insulin, along with many other drugs that are necessary to sustain life, is a problem plaguing many Americans that live with chronic illnesses such as myself. So this has led to many people taking desperate measures such as rationing insulin that have led to death in many cases. So what will you do to combat this issue?
I have talked to dozens, maybe hundreds of Americans around the country who've had to make terrible, tragic, horrific choices where they're choosing between medicine and food or medicine and food for their children, and it has to stop. Now, one of the virtues of this Medicare for All plan is that if we expand public access, we can get the prices for insulin and other drugs way, way down. One of the things I would stipulate almost immediately as president is, look, you have to charge the American people the best price you are charging other people in other countries. Because there are times when they are charging us 10 times what they're charging people in another country. And how does that make sense? So we have to make it so that people like you do not have to make those sorts of choices. And obviously, if you have medicine you rely on, you should be getting that without having to strain yourself economically.
So it's just a super simple question. And he says, yeah, when I get into office, we are going to have to negotiate that. And the only way when he says we are going to negotiate, the only way you can make that a reality if you are going to negotiate as an insurer is if we have single payer. That's the only way we can negotiate that, unless they make an actual law, pass a piece of legislation that says you can't be selling to Americans the same drug you sell to Canadians at 16 times the cost, at 500 times the cost, because of our insane laws that allow these pharmaceutical companies to hike up the prices whenever they want. Yes, I think single payer is the best way to go about it, because if you have just one insurer and that insurer be the government, they get to negotiate the prices, saying, all right, this company, this pharmaceutical company will not sell us insulin at a reasonable price, at the same price that they're selling to Canadians. We're going to go to another company, and that's how you get those insurance companies to deliver the meds at a decent price, at a price that they're selling to other countries, which is insane, right? It's insane that they actually do that here in the States. It's mind-blowing. As healthcare providers, you nurses out there, you know when you have a patient in the hospital and they say, I can't afford this medication, you have patients stay in an actual hospital days longer than they would, because we're trying to figure out a medication they can go home with, which their specific insurance company will pay for.